Welcome to today's webinar. We are going to cover tips for federal employees who are close to retirement. And I'm lucky enough not to have to do this alone. I've got Alec Sunners here.
Thanks everyone for joining us.
So to start off, something we want to make clear is that, as it says in the title, this is for federal employees. So if you're not a federal employee, you're welcome to stay along, but it might not be as beneficial for you. And the other aspect, the more serious aspect, is that we're going to focus a lot on FERS employees today, not CSRS. CSRS, there are some that still exist, but most employees today in the federal government are FERS employees, and that's what we're going to cover. So starting off, we've got some life insurance. What should they know?
So FEGLI is the Federal Employees Group Life Insurance. We're going to be talking about whether you should keep it or whether you should drop it. So I want to define what the basic coverage is for FEGLI. You receive a death benefit of your salary, rounded up to the nearest 1,000, plus an additional 2,000. So what that means is if you have a salary of 97,500, it's going to be rounded up to 98,000 plus the additional 2,000 for a death benefit of $100,000. If you die before your age 35, your benefit is doubled. So in that prior example, that $100,000 would be doubled up to $200,000. The way the premiums work is you pay 2/3 of the premium and the government pays the extra 1/3. So people read this, people hear this and they go, wow, that must be a great deal. I'm only paying 2/3 of my premium. Even though you're paying 2/3 of your premium, it's still a really expensive policy. It's really expensive, and every 5 years, your premium is going to go up even more.
Kind of sounds like Bed Bath & Beyond. It's like, or maybe Kohl's. It's like they've got this 33% discount, but it's still not really that cheap.
Yeah, because they raise the price and then they discount it down.
Right.
Yeah. So one thing to keep in mind about FEGLI is if you do leave the federal government, you can't continue this policy. You can transfer it to an individual policy, but you can't be a part of FEGLI if you leave the federal government. So we were just talking about how expensive this policy is, and it might not be worth it because it's so expensive. Where it can be very beneficial is when you are close to retirement and close to age 65. When you retire and when you turn age 65, you can reduce your death benefits, which can lead to a lesser premium. So if you reduce your benefits 75%, your basic coverage is now free throughout your entire life during retirement. You must retire and be age 65, but if you're getting close to those numbers, it might be beneficial to keep the policy, even though it's pretty expensive.
So it sounds like really the biggest benefit to this is that free basic coverage. But for anybody that's healthy and they still plan on working for a little while, they really should look at an individual policy versus this FEGLI policy.
That's exactly right.
Got it. So first fun fact, we got a few for everybody today. What's the first one?
So if you are a U.S. Postal Service employee, you receive your basic coverage from FEGLI completely free.
And we even have a post office right next door to our new building. So I wonder if they know.
Yeah, hopefully they're tuning in.
Yeah, we'll have to let them know. So the next thing after life insurance is long-term care insurance. What should people look out for there?
So the federal government has their own long-term care policy that you can be a part of. Their pricing schedule is based solely on your age. They don't take into effect family history, your gender, your current health levels. So where this is very beneficial is for women. It's a great value because it's only based on your age. And since women tend to live longer, they also tend to have higher long-term care costs.
Right. That's a good point.
Another key benefit of the specific federal government long-term care policy is it's a partnership program. What this means is for when the long-term care policy pays out, those assets, you can protect assets up to that amount. So for example, if your long-term care policy pays out $150,000 for your long-term care, but you have long-term care needs greater than that you can't afford and you need to use Medicaid, you can protect up to $150,000 of your assets that don't qualify for when Medicaid looks at your assets.
Right. Which is a really, really important thing. You don't want to use up all your long-term care insurance and then them also be able to come after your assets. This partnership program really helps that.
Yep.
Right.
So it's a great policy, but you need to quote other carriers. Because the pricing is based solely on your age, there's different factors that can come into play that other carriers might be able to give you a better policy for a better price, or just the same policy for a better price.
And we've had a lot of clients, and this is going to be your next point, that say, well, what if insurance is not for me? What should they do?
Yeah, long-term care isn't your only option when thinking about long-term care needs. So the insurance is only a piece of the overall plan. One other option is to self-insure. So if you're an individual that has accumulated good wealth over your lifetime and you have $5-10 million saved up, long-term care insurance might not be a good benefit for you because you have the assets to pay for it if you have that need. Another option is a continuing care retirement community. What these are is you pay an upfront fee when you enter, and then you can pay a monthly maintenance fee to cover, based on the contract you have, can cover nursing care, skilled nursing care, et cetera.
Right. And then it's that type A contract that they go in there living independently. They have to go in living independently. And then as they need assisted living, skilled nursing, the monthly price stays the same.
Right. No matter what need you need, if you have a type A contract, it's covered.
Right. So separate from the long-term care insurance, it's having this overall plan. But for federal employees, this long-term care policy sounds like it's a good option.
It's a good option, but keep in mind that there are other policies out there and you would just want to compare. It might be the best option, but we want to make sure of that before you actually sign a contract.
Good point. So next big one here, big question we get from federal employees, should I enroll in Medicare? So first things first, as a lot of people know, you've got to be on federal employee health benefits for 5 years to be able to carry it into retirement. So then the next question is this big one, should I enroll in Medicare? The answer is probably. And then people ask, should I drop federal employee health benefits? And the answer is no, you do not want to drop that. In kind of summary of the big picture here, you really want to look at a federal employee health benefit plan with Medicare enrollment incentives, because those are often going to be better than just doing a federal employee health benefit without Medicare. So this gets a little confusing. So let's look at how it all comes together. So we've got this puzzle, this health insurance puzzle. And on the left, we've got most retirees. And on the right, we're talking specifically about federal employee retirees. So most people sign up for Part A, covers hospitals, things like that. Federal employees, we would say most should do the same thing. Sign up for Part A. Next part, Part B, same thing. This covers physicians, and this costs about $148 a month this year. It's going up pretty significantly next year to about $170 a month. Federal employees, same thing. They should also sign up for that. Now, after these two parts, most retirees do what's called a Medigap plan. So think of Swiss cheese. There's a lot of holes. Medicare Part A and Part B is the Swiss cheese. The Medigap plan really fills in those holes. And the last part of what most retirees use is a Medicare Part D plan. This covers prescription drugs. Where it differs for federal employees, though, is this is where their federal employee health benefit plan really works in the way that Medigap and Part D cover most retirees. The federal plan fills both of those holes. And you really want to look into those federal employee health benefits that have the Medicare enrollment incentives. That's what you're looking for. So fun fact, and I think we talked about how many people might not find this fun, but there are more than 250 health plans in the federal employees health benefits program. We don't have time to go through every single one of those today. But for people who are not yet at Medicare, what should I do before Medicare? One of the things you should look at amongst those 250 plans is a high deductible health plan. If you are healthy. So why would I get a high deductible health plan? That doesn't sound good. Well, a high deductible health plan, you're going to save a decent amount in a premium. So let's say you save $100, you save $200. If you have that high deductible, it only matters if you're using your coverage or not. If you're healthy and you're not really going to the doctor that much, then you can increase your risk by raising that deductible, but you're simultaneously decreasing your premium that saves you money. So what you can do with that saved money is invest it or save it in a health savings account. And a health savings account, Alec, I think you would agree, most of us find a health savings account to be the most exciting account that's out there. It is tax-free when you contribute to it. You get that deduction. It's tax-free while the money's in there. And when you pull the money out, it's tax-free if you use it on medical expenses. So it is the best account out there. And if you're healthy, a high deductible health plan with an HSA can really make a lot of sense. So the next big topic here is the FERS pension. How much will my pension be? So plenty of people might be familiar with this, but we're going to do just a recap here. And that is, there are 3 parts. You take the high 3 years of your salary, you average that out. You take the number of years of creditable service, and then you take a pension multiplier. All 3 of those things go into what your pension, your annual pension would be. So let's look at an example. So let's say your high 3 years averages out to $100,000. You've worked at the federal government or you have creditable service for 25 years and you have a 1% multiplier. That would be $25,000 per year. Pretty simple. You work 26 years, it's going to be $26,000 per year. If you work longer and that 100,000 goes up to an average of 125,000, it's going to change the calculation as well. So the next question is, when can I collect my first pension? And there's a couple different options. You can get it at 62 as long as you have 5 years of service. You can get it at 60 if you have 20 years of service. And then there's these other options about the MRA, which is the minimum retirement age. So if you work for 30 years, you can collect at your minimum retirement age. That age depends on your date of birth. So you could do that at 30 years of service, or you could do it at 10 years of service. But if you do it at 10, your benefits are going to get reduced. So the question is, what do most people do? Most people retire at age 62, I'm sorry. And that is because after 20 years of service, which federal employees often work there for a very long time, that multiplier goes from 1% to 1.1%.
And you may be listening and saying 1 to 1.1, that's really not a big difference. The key is the cost of living adjustment.
Right.
So if we go back to that previous example of $100,000 with the $25,000 pension, that's at 1%. The 1.1 goes up $2,500, and now you're at $27,500. Right. A little benefit in year 1, but then each year it's going to compound on itself because of that living adjustment. So at age 62, yeah, the difference isn't too much, but after 10, 20, 30 years, that's a massive difference in your benefit.
Right, right. And 2 things to note on that beginning at age 62. So if you started collecting at 60 for some reason, your cost of living adjustment actually doesn't start until 62, just like Alex said. The other thing to keep in mind is that there is a Social Security supplement that stops at 62. So you might have been getting a little bit of a higher pension before 62, and then it goes away once you reach 62 because they know you can then sign up for actual Social Security. The other important detail here is the survivor benefit. So sadly, we've had some clients pass away early. We've had some, spouses pass away early. And this is all about planning for those kinds of contingencies from a financial perspective. Many federal employees have the option to at least take a 50% survivor benefit. So you have to look at what is your life expectancy based on your family history, your health, and decide, should there be a survivor benefit? For a lot of people, the answer is yes, but it depends on their specific goals and their specific circumstances. The other aspect of all of this, when you take a step back, is really looking at the big picture. If you kept working, you can increase your high 3-year calculation. You could have those extra years of service toward the pension, and you could contribute more to your TSP. So separate from that specific formula of your pension and when you could collect, you should look at this bigger picture. And that takes us to our last fun fact.
Yep. So a thrift savings plan has approximately 6.2 million participants in it.
That is a lot of participants.
It's a lot of people contributing to their retirement.
It really is. So tell us a little more about the TSP. What should people know?
So let's start with the investments. There's 6 different investment options you can choose from. They have index funds, so the GFC, S, and I funds.
You got to turn that into an acronym somehow. Yeah, got it. Sorry, go on.
And then we have life cycle funds. So the GFC, S, and I are index funds. So the G fund is invested in a weighted average of the current US Treasuries. So it's usually your safest option if you're a very conservative investor. The F fund is your fixed income fund. This is going to track the US aggregate bond index. The C fund is your common stock fund. So this is when people think of, large cap stocks. You have Facebook, you have Netflix. That's the S&P 500 index fund. The S fund is your small and mid cap fund. So that's going to track stocks that are not in the S&P 500, a little bit more risky, potential for higher upside with these smaller mid cap stocks. And then your I fund is your international stock fund. So this is getting your exposure overseas outside of the United States. The life cycle funds are your target date funds. So what these do is they invest in the GFC, S, and I funds, but they reallocate based on when you expect to retire automatically. So if you expect to retire in 10 years and you invest in the life cycle 2030 fund, it's going to invest a little bit in each of these different funds. And as you get closer to retirement, it's become less and less aggressive. Now, if you say, I'm pretty young, I have ways to go to retirement, I'm an aggressive investor, you might want to do a life cycle 2050 fund. That's going to invest aggressively more in international, the S&P 500, the small and mid cap stocks, and less in those US Treasuries and bond index funds.
So it sounds like with the life cycle funds, those for people that are not looking at their account, every month or every quarter, life cycle funds, while not perfect, those are probably what make the most sense for most investors in the thrift savings.
Yeah, most investors would benefit from the life cycle funds because, like you said, they don't have to go in and reallocate themselves based on the market performance and how they're investing.
Right. So what about distributions? There's a lot of nuance to this, a lot of important things to know.
Yeah, so during retirement, you have 3 different options of how you can take distributions. You can choose one of these, 2 of these, or a combination of all 3. So installment payments, you can either do fixed payments or payments based on your life expectancy. So you can either do these monthly, quarterly, or annually. So if you already know what your retirement needs are and you say, I need $1,000 a month, you can go ahead and set that up, and each month you'll get sent $1,000 from your TSP. You can also do partial withdrawals. So if you have an immediate need for money, something comes up, something breaks, life happens, you can go to your TSP and say, hey, I need $5,000, and you can take that partial withdrawal. This is limited to once a month. So if you say, I need $5,000 for this item that happened, and then 2 weeks later, you need another $5,000, you can't take that from your TSP. And lastly, you can do an annuity purchase. So this is where you transfer funds from your TSP to an annuity company and purchase annuity. And that means you would get a guaranteed payment based on all the different annuity options that you choose. You can do a single life expectancy, joint life expectancy with your spouse, et cetera, et cetera.
And one of the good parts about that annuity is then it's kind of a guaranteed aspect to your retirement. But it sounds like, kind of as we're talking about the first pension earlier, it becomes very similar to that, and you've lost your liquidity. You can't just take out $100,000 if you needed it. You're kind of locked into that annuity contract.
Yeah, it definitely sort of duplicates what you're already getting with your pension.
Right.
So if you're interested in the annuity option, you should talk with your advisor, talk through your options, and see what the best option for you is.
Right.
So you have these 3 options during retirement. You don't have to take anything out until you turn age 72 and you separate from service. So if you are 72 years old and you're still working and you don't want to take anything from your account yet, you don't have to, as long as you're still working with the federal government. But once you officially retire and you're over age 72, you have to start taking required minimum distributions.
Good to know.
So the TSP beneficiary account. So this is when someone has a TSP, they passed away, and it is inherited by someone else. Most non-spousal beneficiaries must distribute the entire account within 10 years of inheriting it. Spousal beneficiaries have different options. So if they were also a federal employee and they have their own TSP, they can roll that into their own TSP and take the RMDs when they would be expected to. The other option is they can keep it in the inherited TSP and take the RMDs based on when the spouse was supposed to start taking their required minimum distributions. So let's say that you're already 72 and you have your own TSP and your spouse passes away, but they were only 65. If you don't want to take the RMDs yet, you don't have to. If you keep it in their TSP, you don't have to start taking the required minimum distributions. And so they would have turned 72, so in 7 years. There is a major tax consequence if you die with an inherited TSP. So let's redo another example. So if you have a spouse that works for the federal government, but you did not, and you had 2 children, and your spouse passes away with $1 million in their TSP, if they were age 65, you could keep their TSP where it is. You don't have to take any RMDs until they would have turned 72, so that was in 7 years. So the account is growing. It was at $1 million. Let's say in 5 years, good market, it's now at $1.5 million. If you pass away, that $1.5 million is distributed outright to your children, completely taxable.
Just a huge tax bomb.
Huge tax bomb.
Right. So they have 2, let's say they've got 2 kids, that $1.5 million was in the inherited TSP for the spouse, but then that spouse died. Those 2 kids are going to be paying tax on $750,000 each on top of whatever their own income from their own jobs are.
Exactly.
So they got potentially $1 million of income. And you think about the tax rate on $1 million versus, $100,000 spread out over 10 years, massive difference there.
Yeah, it's a huge thing. There is a way to avoid this. If your spouse dies with a TSP and you inherit it, you can then transfer that to an inherited IRA. And that will circumvent, if you pass away, it won't be distributed outright to your beneficiaries. They would get it through an inherited IRA as well.
Right, good point. So the question is, how does all this come together? We've got the pension, we've got the TSP, we've got Social Security, health insurance, long-term care. There's a lot of moving pieces, a lot of parts to this puzzle. And the last fun fact that we have for you is that you're not alone. We can help you with this. If you have any questions at all, we want you to reach out to info@financialconsult.com. You're welcome to call us at our phone number there as well. But it's important, regardless of whether you decide to work with an advisor or not, that you really develop a plan and you really look at all the different pieces there and how they come together to make sure that your retirement is as successful as it can be from a financial perspective. Any parting words of advice?
We're headed into the holiday season. I hope everyone just has a happy and safe holidays.
Thanks to everybody joining.